Okay, I'm Bob Barker, and Jeremy has been freaking out about the number of slides I have here, but we are going to go through these quickly. Back up. So what I want to talk about here is for innovators, right? How do I get my innovation into the market? This is primarily kind of a B2B thing, right? The market structure is really important, but it's often overlooked. Right, in these B2B markets, they often consist of a system of interconnecting enterprises, different businesses, right? And these businesses have either collaborative or symbiotic or sometimes opposing or competitive relationships, but they rely on each other. And then there may be other entities like regulators, the government, and I had a throwaway example of the car industry with dealers and things like that. But the real point is that you have to understand how your innovation not only helps one of the actors, but how does it interact with the system as a whole, and can it actually be adopted in light of the structure and the way that the system works. And I will proceed with a case study here that is truly based on 17 years of banging my head against the wall. Or, as I say, how 17 years of success can really feel so unsuccessful. Right, it's the connected home medical device market, right? Everybody familiar with Philips and Respironics, CPAPs and ventilators and things, right? They're medical devices. They're used in the home, right? And we're seeing more and more medical devices and therapy devices to help overcome some medical condition, or monitoring devices to help monitor the progression of it. More and more of these devices are being used in the home because nobody wants to go and spend time in the hospital or live in a nursing home, and the health systems don't want to pay for it, right? It's better for everybody if people can stay in their home and manage their condition, right? So there's more and more devices popping up every day. Every time I turn around, there's some new and novel medical device. It's awesome, right? And these things have great potential, right, to reduce healthcare costs, to avoid preventable outcomes. Like there was one that I saw a couple of months ago. It's a tool for monitoring the progression of diabetic neuropathy, right, to avoid, say, it getting so bad that you have to have your leg amputated, right? Everybody wants to avoid that. The health systems want to avoid that because it costs tons of money to do that. But in the healthcare market, there are some significant market structure barriers, right? Incentives of some of the players in the market, and the complexity that is impeding the adoption of these devices. Now, we haven't hit a wall yet, but as this grows and the number of devices and the number of patients use it, it's going to run headlong into a wall. So just to talk about the market structure, right? Just let me look at my notes here, right? So these systems, right, there's lots and lots of devices. They're built by device manufacturers who have to go through a medical device process, clear it with the FDA in some cases, and so on, right? But then there are all these consumer side, not people, right? We're not talking about the patients as consumers, right? They're patients from this perspective, right? But the healthcare system, right, the UPMC or AHN and so on, some of the equipment providers like Apria or Lincare sometimes, or Healthcare at Home, you see their trucks driving around. They're delivering equipment like this to treat patients in the home. All of that, though, forms this network, this system of interrelated players. They're different businesses, right? And so if you think that, most people who've been in big companies, they think silos, right? We've got all these silos. These are not even silos. These are different continents. Right? Now you're crossing an organizational boundary, you're talking about a completely different continent. And each one of them, they have all of their own, their own IT systems. They're complicated. They've got their own business processes, and they're trying to work together. And that's one of the things here in the connected home medical space is, right, they're trying to work together to care for a single patient. Right, so but they're all also navigating their own particular challenges, right? Health systems, right? They've got incredible churn, right? Providers, doctors and nurses and so on, they come and they go, right? They've got, and so they're dealing with training and managing all of that. They all have their own silos and IT landscapes internally that, they're struggling with. But it's a team sport, right? They really are. They have to work together. And so in order to do that, right, they have to collaborate, communicate, share data, and so on. The problem, and this is where we get to the, sorry, I'm going to skip over some of these slides. Right? This is where we really get to the structural barriers, right? Right now, all these device manufacturers, guilty as charged, they're building their own cloud applications, right? Why? Right? This goes back to their motivation and their strategy, right? What are the incentives? Well, they don't want to they want to control the data. In some cases, they have to control the data because they have FDA regulations. On the other hand, they want to, they need to share that data with their providers. And so these incentives, right, they're all building their own applications, but the health systems can't adopt 50 different applications if they want to use 50 different devices for 50 different diseases. They just can't adopt that and manage that. And so this really is a structural barrier in the market that every device manufacturer is going to run into as they try and get their device used by all the patients that it could possibly help. So that's a great example of the structural barrier, and that impeded the adoption of our product. But, how do you cut this Gordian knot? Well, maybe, if there was, kind of a central hub that all of the manufacturers could trust that it's not going to commoditize them or disintermediate them, and, it knew who everybody was and who could see what, and what brand, say a doctor should see. So that really helps them. That would really help, and if that existed, it would be called the Cloud Hammer. So that's a little plug for anybody in the medical space who wants to talk to me about this kind of thing. But again, the takeaways: market structure and the players' relationships and incentives can be a real barrier to the adoption of innovations, especially as you think more broadly about innovation. But then sometimes that leads to an opportunity for innovation of its own.